Hello everyone. So karon mag review ta ani nga topic. So this is other complications of pregnancy. We have hyperemesis gravidarum. So ano tang namali diri? So after aning mga practice questions mo diretso na ta sa PPT para atong tumong kay di na ta mo balik ani nga PPT. Kay maglantaw na lang ko, di ba? So let's go. A patient with hyperemesis gravidarum, admit siya sa ospital. Unsa man ang serum analysis nga imong ma-anticipate. So, mo-increase iyang BUN tungod kay significant fluid loss. Sige kag suka, di ba? And naga-dehydrate. This leads to hemoconcentration. So, mapilit ang tugo and ma-decrease ang renal perfusion. So perfusion kay na mag-oxygen sa atong organs. So muna ang ma-elevate ang BUN. Dili ma-decrease ang hemoglobin day. Rather ma-increase ang hemoglobin munang hemoconcentration. Next natong mali kay performing therapeutic removal of a patient with polyhydramnios sa atong reason for very slowly ang pag-remove nato sa ato ang amniotic fluid kung natay polyhydramnios para ma-prevent nato ang complication na abruption placenta. So katuning mo hinay-hinay og dili mutapot ang placenta. So which nursing diagnosis would be the highest priority for a patient with PROM? Sige, so magka-risk siya for infection kay mabuak naman ato ang amniotic sac. So at risk siya for infection becomes the most immediate and serious threat sa ato ang mama. So next kay ang patient nga naay hyperemesis gravidarum is likely to exhibit which of the following laboratory factors? Again, ganina, increase ang hemoglobin. So og BUN. So asa marami mag-decrease niya fluid. A patient is diagnosed with anaphylactic syndrome of pregnancy. Kanang sa ka magka-anaphylactic syndrome of pregnancy and is unable to breathe. What is the immediate first priority action? So the immediate first priority action nimo kay mag-provide ka og oxygen inhalation. So timan an oxygen inhalation. Ang first step in managing acute respiratory crisis is to provide oxygen to address severe hypoxia, following the principles of airway and breathing before circulation. So, muna siya guys. Dapat na unahon sa nato og oxygen inhalation kung natay anaphylactic syndrome of pregnancy kaysa dili ta mag CPR kay kung mag CPR ta walay pulse pero naman ay pulse siguro following the oxygen inhalation siya kay di ka siya kinhawa. Anaphylactic biya kay murag allergy, severe nga allergy. So next na quiz kay mo ni siya. A patient hyperemesis improving. Which dietary instruction is most appropriate for her transition to oral intake? So incorporate a midnight sack into the daily routine. Muna ato ang small snacks para sa mga taong na hyperemesis gravidarum. So during the induction of a labor for a post-term pregnancy, what is the specific role of misoprostol? So misoprostol, muna siya ang magpa-relaxant sa ato ang uterus. So relaxant, misoprostol, or mifepristone to. Timan-in ang mga difference sa mga drugs ha. Mifepristone o misoprostol ang say difference nila kay sa post-term pregnancy, misoprostol atong gamit. Prost. So, prostaglandin analog siya, used to soften, efface, and begin to dilate the cervix ripening in preparation for labor abortion. So, kagbasa rin ni Mon sa may pasabot. Ay, sa ka-distract sa mga saba sa kawaspi. So, i-initiate niya ang cervical ripening and dilatation kay mahita ba maganda aning post-term pregnancy kay dili magadilate ang pregnancy. Dili siya magadilate. So, crazy kayo, di ba? Dili makagawas ang bata. Ay, di siya magadilate. Samok ni mo eh. So, mauna siya. Ba't ka galit? So, murang natin misoprostol kay para ma-soften, ma-efface, o madilate na or ripen ang cervix. Unsa nga complication, direct results of the overdistension of the uterus in a patient with polyhydramnios. Premature rupture of membrane. So, tungod kay na overdistant ang uterus, sa polyhydramnios daghan og amniotic fluid kay nagka-premature rupture of membranes, like nimbuto siya prematurely. So, from large volume of fluid, magka-stretch fetal membranes to the breaking point leading to prom and subsequent preterm labor. So, a patient with oligohydramnios would likely present with which clinical manifestation upon physical examination. So, nakay oligohydramnios opposite, kamay siya amniotic fluid. Unto may present na clinical manifestation niya. Prominent iyang fetal parts and dali ra siya mapalpate. So, mali siya sa difficulty auscultating the fetal heart. Magka-difficulty ba ta auscultating? Dili, no? Kay mas maklaro no nimo. Magka-difficulty kung daghan og amniotic fluid. Meconium aspiration, macrosomia, and oligohydramnios are potential complications associated with post-term. So, complications na siya. So, pasal sa complications, so, sa difference niya sa risk. Risk kay kanang muna yung mga factors nga possible na maka-lead ani nga complications. Complications kay unsay iyahang mga disadvantage or cons kung nakay ilana. So, muna yung pagpasabot nimo. In a case of post-term labor that cannot be stopped, why is a cesarean birth often considered a safer option for the fetus? Kay, para ma-reduce ang pressure on the fragile fetal health. Kay, kung dili ta mag-vaginal rata, magka-cord prolapse siya. Ay, ha? Dili ang rason nga poan. Ang pinaka-rason jud nato kay ang premature infant skull manggod kay vulnerable siya to pressure, di ba? Malleable pa kay siya. So, magka-possible nga magka-intracranial bleeding if mag-vaginal bleeding, if mag-vaginal birth ta. So, munang sa mga preterm labor, nga dili na nato siya mapugngan, kay ato na lang siyang i-CS, no? Kaysa, so idali-dali nimo ni siya CS, di ay? Dali nimo siya CS. Sakto man po di mong rason nga maka-prevent siya cord prolapse, pero ang pinaka-primary reason jud kay ang fetal skull. Kay dili pa kay siya ilana kagahi ba, and magka-intracranial bleeding siya. So, a diagnosis of oligohydramnios in the second trimester places the fetus at a significant risk for which specific complication? Pulmonary hypoplasia. The lack of amniotic fluid for the fetus to breathe. Hypoplasia, hypogamay. So, sa oligohydramnios daw sa second try, say risk nga ma-develop sa nailana. So, magkaroon siya ng pulmonary hypoplasia. So, difficult to breathe in utero, prevents normal lung development, leading to underdeveloped lungs. So, ang meaning sa pulmonary hypoplasia di ay kay underdeveloped ang imuhang lungs baby. So, magka-develop kag underdeveloped makadevelop og underdeveloped lungs kung gamay ra kag amniotic fluid kay importante man ang amniotic fluid para sa baby mag-breathe in utero para sa normal lung development. So, a nurse is monitoring fetus in a post-term pregnancy which potential complication related to placental aging is a primary concern. So, decreased perfusion, fetal distress. Placenta, as the placenta ages past term, its efficiency sa placenta na mag-provide sa fetus o yung life-saving properties kay mag-decrease, leading to reduced blood and oxygen flow. Okay, so abot na ta sa PPT, guys. Yay. So, hyperemesis gravidarum kay occurs daw siya 3 months because of high this hormone, HCG. The production will start to decrease starting from 2nd month to 60th day of pregnancy. So, unsay complications kung naa kay mga cons diay. So, dehydrated ka, weight loss, acidosis ug alkalosis. Acidosis ngano man eh. So, what will happen after dehydration? Decreased blood concentration leading to acidosis. So, what will be vomited? Ang first kay ang food ma-vomited dayon. Lactic acid na lang dayon mabilin. So, muna ang alkalosis. So, natoy pathophysiology nga mo'y acidosis ang kinalabasan. So, ato itong balikan sa PPT. So, serum analysis will show diagnostic test. So, unsa na to pag-determine nga na kay L-ani. So, serum analysis, decrease imong chon, carbon, hydrogen, oxygen, nitrogen daw ni, plus mga plasma proteins sa imong blood, and chloride, sodium, potassium levels. So, increase, so far, maura na siya ang nag-decrease, ang imong chon. So, increase ang BUN, ang hemoglobin, white blood count. So, anong maning ketonuria, breakdown of, unsa nang ketonuria? Breakdown products of fats, ang ketones, breakdown products of fats. Dayon, mato siya sa urine. Ano man? Magbuot ka. When plasma volume falls, renal perfusion stops. Plasma volume fall. Okay, decrease man ang plasma. Renal perfusion, oxygen, drops. So, passive na lang ang so urea reabsorbs in the proximal tubule. Increase. Sige. So, unsay management nato? Hospitalization, we can provide IV, bed rest, and parenteral vitamin supplements and potassium replacements. What do you mean by parenteral? Parenteral is IV, and enteral is you orally do consume something. So, when conditions has improved, so, magamit tataan niya itong special marker diya, guys. Okay. So, when, hospitalization. When condition has improved, small frequent feedings, avoid food, strong odor, spicy, and pwede ka mag-midnight snack. So, management, we also provide emotional support for the mother. False pregnancy, usually ma-happen na siya sa mga tigulang. Explain pregnancy results. Clarify na to nga nung muna siya ang misconception ni mo, ma'am, false beliefs, na buntis ka. Provide referrals, so asa na to siya i-refer sa mga psychiatrists. Provide emotional support and understanding. So, muna siya ang pathophysiology sa hyperemesis gravidarum. So, high levels of HCG, apel na po or estrogen. So, magka-disturbance sa appetite. More likely nga, dili na kayo ka makakaon og tarong. So, magka-weight loss ka and magka-lead kag starvation, which is also leading to dehydration. Munang fluid electrolyte imbalance, dayon. Munang na ay ketosis, hypokalemia, kay decrease betong mga proteins. So, unsa ning emaciation? Weight loss, emaciation. Comment down below na lang guys, unsa nang emaciation. So, pwede po ko na i-highlight para balikan jud. Emaciation. So, unsa may mga nursing diagnosis na to? Risk for fluid volume deficit, maybe. So, unsa man natong i-maintain ni intervention. Maintain blank as ordered until the patient can tolerate oral feedings. Maintain IV fluid. Yes, correct. So, wala tong interventions sa fluid volume deficit. So, maintain until vomiting stop. Ice chip may be given. Wala ko kabalawan eh. Maintain NPO status. So, naka-NPO siya until mahuman na ang vomiting. Then, give butag ice chips. So, monitor blank for input and output ni. Yes, correct. Vital signs, weight, serum electrolyte levels, and urine for ketones. Medicate with blank as prescribed. We can medicate with antiemetics as prescribed. Okay, so para unsa na ang antiemetics? Sa example niya, metoclopramide. Ang antiemetics, guys, is something that anti-acid siya. Anti-emesis pang suka. So, example ana niya kay 1 ampule IVTT every 8 hours PRN. So, unsa pay lain nga nursing diagnosis kay di ba maka-starvation siya. So, dili kayo siya magkaroon ng enough nutrients. So, imbalance iyang nutrition less than body requirements. Suggest lower fluid intake during meals. Kay muna yung maka-increase sa likelihood na magsuka siya. So, ipa-lower na tong liquid intake. Advise the woman that oral intake can be restarted when MSS has stopped. So, pwede ka mag-utro o oral intake, ma'am, kung mahuman na kag suka-suka. So, company and diversionary conversation. I-divert ni imong attention niya at mealtime may be beneficial. Diversionary conversation. Instruct the patient to remain upright for 45 minutes after eating to decrease reflux. So, 45, kanos pila ka minutes nimo siya i-instruct to remain upright. 45. Suggest the patient eat 2 to 3 dry crackers on awakening in the morning before getting out of bed to alleviate nausea. So, also, napug kay fatigue. Kay sige biya kag suka, so wala na jud kay energy, kay imong cells, build imong cells naka-starve na siya. Maybe related to muscle weakness, degree to emaciation. So, emaciation is depletion of body proteins and fat stores from starvation. So, muna ang meaning sa emaciation. Depletion of proteins and fats in your body. So, teach nimo patient to have protective measures to conserve energy and promote rest. Teach relaxation techniques, fresh air, schedule activities to prevent fatigue. So, we also have ineffective coping, maybe due to stress, pregnancy, and illness. So, dili na to ni siya ibaliwala na lang kay possible jud na magkaroon ng ineffective coping ang isa ka mama. So, mo ni atong ma-intervention, mag-give the insurance, encourage the patient to discuss her feelings about the pregnancy, help the patient to develop effective coping strategies. So, next ng NCP, pwede ko na yung mabuhat siguro, no? So, next, ang fifth nga nursing diagnosis, kay fear may be related to fetal well-being. So, i-praise na to ang mother for attempts of following therapeutic regimen, explain the effects of all medications and procedure on maternal as well as fetal health, accentuate the positive signs. So, atong i-highlight more than that. So, preterm labors, Labor after fetal viability. So on some fetal viability, some says it's 20 weeks, some says it's 24 weeks. But here it's 24th week. But before, so nagka-start na siya labor after fetal viability. But before fetal maturity, so 38 man ang term na jud. Premature gyapon siya if 37 after fetal viability before term. So prognosis depends. Prognosis, the likelihood nga maayo siya, depends on birth weight and length of gestation. The lower the birth weight, the earlier the baby is born, or the earlier the baby is born is the lower the chance of survival. So natay mga survival rates kung 24 weeks kung murag napay gamay pa kayo naka-survive ani, but it is possible. All things are possible through God. So, na-record na nga nabuhi 24 weeks. Pero, again, magka-lower ang chances as early as they go out. As prematurely as they are. So, impossible po nga maga-depend na siya is a lot on kanang medical equipments to survive in the future. So, we have predisposing and precipitating factors. Precipitating is something that we can control. We can change. So, for example, is predisposing kay mga genetics, female ka, male, congenital uterine abnormalities. So, pagkabata pa nimo nga na abnormalities. So, habitual abortion, heavy work, or long travel to work. So, muna yung reason nga magkaroon ka ng preterm labor, heavy and long travel to work. Cone biopsy of the cervix. So, kung magpa-biopsy kasi mo cervix, possible kayo na magka-preterm ka. So, meaning sa HX, guys, of GU infection or renal disease. Low socioeconomic class, undernutrition and inadequate weight gain, multiple gestation, inadequate prenatal care, smoking, chorioamnionitis. So, persistent uterine contractions 4 in 20 minutes, cervical effacement 80%, and dilations greater than 1 cm na yung dilation. So, labor na jud kay na siya. So, menstrual like clamping, persistent dull, low backache, feel ka ng possible diarrhea, increased discharge, pink tinge. So, primary neonatal complications, we have respiratory distress syndrome, walay enough nga surfactant sa bata. So, we also have intracranial bleeding, chronic lung disease, infection, visual impairment, and cerebral palsy, as we can see here. So, when we can see someone who is like this, like child na ani, it's a possibility that they were born prematurely. So, pwede ka mag-ask sa parent, kano saan siya na-born, ma'am? So, mo din na siya cerebral palsy, or mo day po nga na siya respiratory or cranial bleeding. So, group of disorders that affects a person's ability to move and to maintain balance and posture. So, mga preterm labor, no? Kay, yeah, ganun sila. So, medical management. Suppress preterm labor for immature fetal lungs. So, if less than 4 cm na, pwede pa nimo siya ma-suppress ang premature labor. So, how do we do it? We do it by bed rest to relieve the pressure of the fetus to the cervix. And we can also provide hydration and may help stop contractions. Tocolytic therapy, terbutaline, and ritodrine. So, mo rin na ang pinaka-common nga tocolytics kay parallaxans, kay ritodrine, and terbutaline. So, inhibit uterine contractions. We also give adequate nutrition and avoid smoking. Dapat lang. And corticosteroids. Accelerate the formation of surfactants. So, betamethasone 12 mg IM every 24 hours for 2 doses, preferred and more potent. So, ang dexamethasone naman is 6 mg IM every 12 hours for 4 doses. So all in all, they have the same dose, pero dexamethasone is more cheaper. So what do we mean by potent? It's more powerful. It can produce more effects. So preterm labor that can't be halted. So kung dili na jud nimo mapugngan, so ang dilation niya is greater than 4, avoid nato siya amniotomy. So amniotomy, butho na lang nato. So ato nang i-prevent. Kaya nga naman, let's see. Ha naman to. Kay magka-cord prolapse na hinuon ta ani. So cord prolapse, mag-una ang cord sa bata and damage the fetal soft skull. Mo na itong gi-test ganina dire. So cesarean birth to reduce pressure. So kanay checkpoint question. When you see a woman in preterm labor in ER, what should you do? First, ask her to lie down in side-lying position and assess her for contraction. So kanina nakita na ako siya sa Quizlet. And so nakakita ko other kinds of questions relating to this MCN2. So pwede nimo to ibalikan pod karon or unya. Sige, karon na lang. So priority nursing diagnosis interventions. So preterm labor, unsa may mga diagnosis na to ani? Risk for, sige, gasa. Kaya ato ang intervention: bed rest, minimize activity, exercises, adequate hydration if necessary, give oxygen, cannula. Risk for fetal injury. So kato di pa, kung greater than 4 cm na siya, di na nato siya i-suppress ang labor. Pero dili ta mag-amniotomy kay soft ang fetal skulls and probably affected ang fetal injury. So medyo na ang fetal injury, ang pinaka at risk ana is ang yahang head. So risk for, help patient get through labor with as little analgesic, so the adequate hydration. With as little analgesic or pain relievers, anesthetic as possible. So risk for poisoning. So kung daghan kitag analgesics, anesthetics, possible nga ma-poison ang ato ang fetus. So may include those related toxic side effects of tocolytic. So kitsa man ang ma-poison ani di ay ang mama or ang fetus? Mama siguro. Fetal and maternal. So it could possibly be both of them ang ma-affected. When giving a beta adrenergic stimulant, so again, remember na to tong 4 ka beta 1, beta 2, alpha 1, alpha 2. An opioid monitor, BP, RR, blah, blah, blah. So, acute pain may be related to labor contractions. 28/80 pa rin guys. Acute pain may be related to labor contractions. So, temporary pain due to labor contractions, give analgesic sparingly. To minimize fetal CNS depression, avoid administering when delivery seems imminent. So kung mahitabo na ang atuang kuan man gud ang pag-way sa pag-relieve nato og acute pain kay mag-give tag analgesics og morphine or mifedipine or meperidine. So kung imminent na di ay ang delivery, dili ta maghatag og morphine guys kay makakausa og CNS depression. Teach relaxation techniques and breathing exercises. Promote diversional activities. I-divert nimong attention sa mama. So, also we have activity intolerance. Unsay pasabot sa activity intolerance? Dili na nimo ma-tolerate ang iyang activity. Kapoy na kayo ko guys. So, possibly the evidence by continued uterine contractions, irritability. So, pace activities to promote frequent rest periods, monitor VS to compare baseline to assess for tolerance to activity. Encourage ang mga special someone. So, the meaning sa SO. to assist with the patient's activities of daily living. Ang sarap meaning sa SO, guys. So, magkaroon po ng anxiety related to situational crisis, perceived or actual threats to self, fetus, and inadequate time to prepare for labor. So, muna yung time nga encourage na tong patient and her family to discuss their feelings and concerns. How are you feeling, ma'am? Diba? So, encourage the patient to discuss the feelings or their concerns. Situational crisis, anxiety related to situation, compromise, family coping, secondary to hospitalization. Encourage private time for the woman and partner. So, comment the strengths of the family unit. Promote assistance of family in providing client care as appropriate. So, unsa tong mga nursing diagnosis of preterm labor, we can compromise family coping. So, ma-compromise ang family coping. Di sila ka-cope kaayo. Secondary to hospitalization. Next, we move on to premature rupture of membranes. So, the preterm labor, kay gawas ng baby. Kani rupture ang membranes. So, asa man siya ni padalong? Preterm labor. So, rupture of the fetal membranes with loss of amniotic fluid before 37 weeks. So, nakuha na yung mga amniotic fluid, guys. Kini rupture ng mga membranes. Yeah, before pa to 37 weeks. Diba? 37 weeks is still preterm. Yeah, before pa ana. So, sa may mga risk factors na to. So, risk factors is different from risk. No, it's what is still the same. So, infection of membranes. So, makakause siya premature rupture of membrane, incompetent cervix, and trauma. Complications. So, unsa may mga cons ani? So, magkaroon ng infection, cord compression, cord prolapse, and preterm labor. Unsa difference sa cord compression o prolapse? Compression, mapiit ang cord, di na siya ka-deliver og accurate supply sa baby. Prolapse, maguna ang cord. So, ang paggawas baby, ron matuok na siya paggawas. Assessment, slow, steady trickle of a gush of fluid in the vagina. So, kung may natubid sa vagina, oh my God, preterm labor na day, ay premature rupture membrane na day. So, we can also do nitrogen paper test. So, as we all know, the amniotic fluid, as we all know, wag pang assuming na alam ng lahat. So, as we know, the amniotic fluid is alkaline. So, kung ang nitrogen paper man gud siya, yellow siya. So, kung positive ka for amniotic premature rupture of membrane mo, plus ni siya to blue. So, this would lead to fern-like pattern on the slide. So, this increase because of estrogen. So, assess important nursing responsibility. Assess for signs of labor. If labor does not begin and fetus is still too young to survive, we provide fibrin-based sealant. Fibrin-based sealant ta, guys. Moran siya kanong atong tapbot nga og fibrin dito sa mama para di siyang padayon og gawas. Remember siya kuan ba bandage if labor does not begin. Pero kung ato nang ibuhaton if wala pa nag-start jud og labor. So ano siya kamaingon labor nag-delete na. And fetus is still too young to survive. Fibrin-based sealant ka. So, nursing diagnosis, risk for infection, anxiety due to situational crisis, risk for injury. So, implementation and collaborative care. Assess fetal heart rate. Evaluate the client's temperature every 2 hours. Avoid vaginal exams. So, munang grabe kayo atong pagkuandro dito. Kanang magkuha tag mga vital signs. It's very important that we take that seriously. So, mani. Okay, guys, so implementation and collaborative care. So, monitor for development of uterine contractions. Lord, flashbacks. Implementation and collaborative. Monitor for development of uterine contractions. Wait, pause.